Good morning, Austin, Texas. I'm Carla Macias, and welcome to another episode of the Best Docs Network featuring Forest Park Medical Center, where it's your destination to better health. Speaking of better health, let's introduce our first doctor, orthopedic surgeon, Dr. Michael Putney.
I was having a lot of pain with the left knee, and I tried all the other little things that you could try, like taking pain medication and just dealing with it, and it kept getting worse. And I had already talked to Dr. Putney about it, and he told me that it was bone on bone. He gave me several options as to what I could do, but in the end I was going to end up having to have the surgery, but I was afraid to have the surgery, so I toughed it out as long as I could.
Typically, knee arthritis is the most common cause of the need for knee replacement. Frequently that can be from sports injuries, other injuries they sustained, or just plain wear and tear over time.
And when it got to the place where I couldn't tolerate the pain any longer, I came back and I talked to him, and he said we would go ahead and do the total knee replacement.
Barbara's complaints were a lot of stiffness and really sharp pains in her knees. And she is a trooper. She really did want to avoid surgery, and so we tried to do everything we could for as long as possible. She finally did get brave enough to have the surgery. Since I've had the surgery, it's been great. I haven't had any problems, and I'm sorry I waited so long to have the surgery. Barbara's recovery has been spectacular. She was up even walking in the hospital without support. She'd had replacement on her hip before, so I think she had some knowledge and expectations of what to expect in the hospital. But she's been very motivated and is working hard on her therapy. I feel great. It's been a week and a half since I've had my surgery. I'm anxious to get up and do things now. I want to go dancing and work in my yard, mess around with the grandkids, because before I could do just a little bit and the pain was so severe I had to sit. And I'm anxious now to just get past this stage of healing, and I'm ready to start running again.
Such an exciting day to be part of the Forest Park Medical Center at Austin, to be able to work with the local community and the physicians in the community to offer outstanding care, cost-effective care, to enhance the patient experience.
Today's very, very exciting. To bring Austin into the Forest Park Medical Center family of hospitals is an absolutely wonderful opportunity for both the physicians as well as the patients here in the North Austin area.
Today is a great day. We're eager to have that bulldozer just doing what we do best, and that's making Forest Park Medical Center Austin a reality.
I think Forest Park Medical Center is the new frontier for our community. I'm very excited about it.
It's really exciting that we're finally going into the next phase of making this dream come true, of bringing, I think, a higher level of care and raising the bar of care for patients and physicians in the Austin area.
I'm very grateful and honored that the doctors here in Austin have confidence in us in the Forest Park model.
We are so proud to be a part of this upcoming new exciting venture with Forest Park Austin.
It continues to be an evolving concept, and it's something that's specific to the physicians here in Austin. We have a totally new design that are really take on the personality of Austin and the physicians that they serve.
Did you know that in 2011, Forest Park Medical Center was voted as one of the top 20 most beautiful hospitals in the United States? Also, Forest Park Medical Centers were the only hospital in Texas to make this prestigious list.
Forest Park Medical Center is your destination to better health. Forest Park Medical Center doctors strive to provide the best care for their patients, not only locally, but also around the world, as we take a look into the LEAP Foundation with Dr. Craig Hobar.
The LEAP Foundation, we've been here since 1991, and we have operated more than 8,000 kids in more than 19 countries. Cleft lip and palate is our main operation, but we identify needs and we provide pediatric urology, we provide eye surgery, we provide ENT surgery, we take care of burn scar deformities. We really try and fill in the blanks of what is most needed in the particular country. We go on 6 to 8 trips a year. We routinely go to India, Central India, the poorest, most remote part of India. We go to Zimbabwe and work in the children's hospital of that country. We go to Haiti multiple times a year because we started going there after the earthquake and developed deep relationships and just saw how many kids were in orphanages and had no access to surgical care. We go to Belize. We've been going to Belize for 18 years. We've been going to the Dominican Republic for 22 years. The most common procedure we do is cleft lip and palate because 1 of every 700 babies is born with this. The children don't have a chance for normal life if it's not fixed. If you do the surgery, then they have a chance for a perfectly normal life. I didn't start out in 1991 to build the LEAP Foundation. I went on a single mission trip, and you know, it convicted me personally that there was such a need out there that I wanted to help as many people as I could. But the excitement from the other doctors and nurses who developed the same passion is what convinced me that no, this wasn't a single mission trip. We're going to go on another one, and then you know, God filled in the blanks. We're here 22 years later. We've done more than 8,000 surgeries, and you know, the opportunities to help people just keep growing. And we all do it because we're helping other people, but it also helps us too. It helps refreshes why we went into medicine in the first place. But we do it with a world-class quality. We don't do anything in another country that we can't do with world-class quality equal to what we can do here.
Best Docs Network featuring Forest Park Medical Center is your destination to better health.
The things that make Forest Park unique are our focus on what's best for the patient and what's best for the physician. We're different in many ways than other organizations because our physicians are our owners, they are our bosses. And to that end, we want to do whatever we can to be sure that they get their needs met.
We're here for them, they're here for their patients, and working together, and we're not fighting a bureaucracy, we're not fighting a corporate office that's not even in the same state as us sometimes. We're making what's best for this hospital at this moment at that time. We don't have to wait, and that's what our physicians like, immediate results.
As new things become available, like the Mako robot, some of the new technologies, Forest Park's very quick to want to be a part of those things. If that's something that our surgeon wants or feels like would benefit his patient population, we're willing to do that for them. And that's exciting to have an organization that leaps forward that quickly.
It is just so much more collaborative. They're very involved in their choice of equipment. We try to involve them in any major decisions so that they feel that they have a buy-in to this, they're part of it. One of the physicians said to me the other day, I feel like I've worked with this team for years because they just got the flow down. It just works.
Michael has a question for Dr. Terry Chambless. When do I need to get my first colonoscopy?
Everyone needs a baseline colonoscopy, which is about 120 centimeters long scope, and the patient is sedated for it and they don't feel it when they're age 50. And then depending on what's found, it can be a repeat colonoscopy anytime from 1 year later to 7 years later. Now, if there's a family history of colon cancer or colon polyps, we move that up 10 years to age 40.
For more information on Forest Park Medical Center and their doctors, log on to our website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab. Now on to our next doctor, who takes family care to a whole different level with his concierge practice, Dr. Mason Jones.
Well, the #1 killer in America today is, as most everybody probably knows, is cardiovascular disease and complications related to that. It's a serious problem in our country, and it's hard to lay blame. You know, we all tend to eat too much. What it all comes back to is basically absolute caloric restriction. Where you get in trouble with any food is eating too much of any one thing. As far as the recommended daily caloric intake, really we need on average about 1,200 to 1,600 calories a day basically to survive. You can get by on less, of course, but you know, the average American doesn't need more than about 2,000 calories a day, really. Most of us probably take in twice that. The calories sneak in everywhere. And the key with weight loss is slow and steady, baby steps. Anybody can drop a ton of weight all at once by starving themselves. The problem is that our bodies are really efficient at reabsorbing all those calories when you fall off the wagon on the back end. But there's really powerful data behind daily exercise. If you take one group of folks and keep them sedentary and one group of folks and you start moving them around, the folks that are more active have lower risk of heart disease, stroke, high cholesterol. I mean, you name it, the benefits are many and varied. The key is that it needs to be at least 30 minutes uninterrupted at a good clip. And as far as exercise specifically, what do we recommend? Well, strength training is probably the single best exercise. And the reason why is because strength training has a feedback where not only do you strengthen the individual muscle that you're exercising, but those muscles stay metabolically active for hours and hours later, continuing to remodel and burn calories. Additionally, when those muscles pull on the skeletal system, they force the skeleton to stay stronger. Strength training has really a huge array of benefits, and it's my go-to exercise for anybody, even if you're just starting. And it can be as simple as doing push-ups on your knees, on the floor in the house. But strength training is really where it's at. And the beauty of it is you can do it anywhere, and there's no excuse. It's not, oh, I can't afford the gym, you don't need the gym. Oh, well, I'm traveling, well, do it in the hotel room. You can do it anywhere.
At Forest Park, we call it the 6 senses of Forest Park. And you have your conventional 5, and it talks about the experience that you get from the minute that you come onto our campus. So we're really kind of playing into those senses. So what are you seeing when you first get on the campus and walk into our hospitals? Are you looking at just great architecture? Or are you looking at a brighter environment, with natural sunlight and things of that nature? The art program is something that plays into the healing aspect, the visual aspect. So you'll see sculpture, you'll see original pieces, you'll see prints, you'll see a little bit of everything. And the way that we attack art is you should feel a little bit uncomfortable with art, because if every piece of art in our facilities was something that you absolutely loved, then you probably didn't reach the entire community, because we all have different tastes, different aspects of what we like. What are you smelling? We have engineered scents in all of our hospitals to where it's an engineering system called ScentStream, and it's built into our HVAC, and the scent that Forest Park has chosen is called Clean Sheets. But other things that you have just kind of coming into our environment is, what type of food are you having, the taste. We don't have cafeterias, we have dining facilities. What are you hearing when you come onto our campus and into our facility as well? Oftentimes in every facility that we do, we have water features, both outdoor water features and interior water features. So it provides a calming type sound that resonates throughout our facilities. What are the things that you're feeling? We have a lot of textural elements associated with our design. When you're coming in, the textural walls, whether it's the stone-cut exterior of a lot of our facilities, or when you're coming inside and you're feeling the texture of the fabric itself. We really try to to play into all of those senses for our patients. So, you know, whether it's in the lobby or it's in the patient rooms, or, you know, the thread count on the sheets, you know, those are the type of textural elements that really you may not instinctively know about those, but when you actually touch it and feel it, it'll make a difference to you. Every one of our facilities is a minimum of LEED Silver. So what that means is it's our environmental impact to the community as well. So we have rooftop gardens where you have lush gardens that can be seen from all of our patient rooms. You're seeing planting, you're seeing stone, you're seeing in some cases water features associated with even our green roofs. But it's something that really kind of plays into the sixth sense of Forest Park, which is heal. And having a patient room that looks down onto grasses and trees and plants, and you know, it intrinsically has a healing aspect that really our patients have grown to appreciate. Again, we're playing to each of those senses, and then our sixth sense is heal, because at the end of the day, that's why we're here. We're here for the community, we're healing patients, and providing a place for our physicians to practice medicine. Walking onto our campuses, from step one, what we really kind of focus on is that entire experience. It should look and feel not like a hospital, but it should look more like a hotel. You're really seeing something different. It has a completely different feel from anything else that you've seen in the market. You know, our job as developers and as Forest Park Medical Center is to deliver a facility that's different than what the physicians are used to, what the patients are used to.
From staff to surgeons, from technology to technique, Forest Park Medical Center Austin is your destination to better health.
I had 2 surgical procedures at Forest Park. I had bariatric surgery in September, and I've had my back surgery in April of this year. The staff at Forest Park was cordial, respectful. The checking in process was done efficiently. There were no surprises. They had called me the evening before to remind me of what I needed to do to prepare myself. I sat in the waiting room a minimal amount of time before I was called back to begin the pre-op procedure. In both cases, I was in on one day and I was out the very next day, and felt very comfortable during the process.
Just walking in, it did seem like a 5-star hotel, but we were greeted at the desk by the concierge. They gave my husband a pager and explained to him what the paging system was like. They would send him a text how I was doing in surgery, where I was at, everywhere in the hospital. He was able to see at any screen where I was. And so it gave him a great sense of comfort knowing that, you know, he was being, even though it was electronic communication, that still somebody was letting him know as I moved through the progression of the surgery area, the recovery area, back to my room. He knew. It was incredible how the staff made sure that my family was taken care of while I was being taken care of.
I felt like I was in a 6-star hotel. The service was great. The people were wonderful. I really felt that I was treated as if they really cared about me and wanted to help me and get me to start recovering quickly.
And I felt really good being there. I didn't feel like I was in a sterile environment. It just felt homey. And that was nice because, you know, when you're not feeling good, it's good to be in a place that feels like home. And it was a place that felt like home. And my husband was able to stay overnight with me.
The nurses, the staff, everyone seemed really happy and ready to help you out. Where I've been to hospitals where it just wasn't like that. The rooms at Forest Park were extremely clean. The exterior, when you first see Forest Park, it does look like a 5-star hotel. Everything about it was a good experience.
Forest Park Medical Center is a physician-owned hospital in Dallas initially. We began as a group of physicians the idea before 2007, but it really got serious around that time, about developing a small facility that was focused on surgical specialties to deliver efficient, high-quality care that we really thought would be the best in the Metroplex, and built a facility which is, I think, very patient-friendly, very unique. And from a physician's standpoint, it has been an extremely unique experience.
I ask my patients all the time if their experience was what they had hoped it would be, and we try to meet, and in most cases we significantly exceed their expectations. If there are any issues, as may come up from time to time, it's something that's easily addressed because of our attention to detail and our ability with our administration to quickly correct any problems that may be in the process. And so it's been a really good experience for all of our patients as well as the physicians as a place to practice.
What I like about Forest Park is that the hospital itself is centered around the patient and around the doctors. It's centered around the patient in that we strive to give the patient the best possible experience from the moment that they first contact the hospital, from that very first phone call to the moment that they walk out that door. And we want to make sure that they feel that they've had the best care possible. Specifically with regard to the doctors, Forest Park creates an atmosphere that allows me to take care of my patients in the best way possible without having to worry about other administrative problems that you commonly encounter in other facilities.
What makes Forest Park great is that they're able to support the physician. When a physician needs something, they're able to listen to the physician and respond to that, and rather quickly. If I need to bring in new equipment like the Reflux Center, they were able to sit down, talk about what the need was, evaluate what the need is, and then they went out and bought the equipment. That's something that you generally don't see in other hospitals in the area. And I've worked in all the major systems.
As physicians, it allows us to continue to practice an aggressive form of medicine where we feel like we're delivering state-of-the-art care. And it's a facility that really fosters that type of physician and that type of mentality.
One great thing about Forest Park is that they include the dining aspect or the food aspect as far as the patient care. Not only do they have great dietitians on site to make sure that the dietary needs are met for the patients, but they also consider the patient's family's needs as well. Let's face it, sometimes you're in a hospital, this facility, 6-7 hours, if not longer, sometimes overnight, sometimes 2 or 3 days. And it's not the typical food. We do everything from scratch, which means that we do everything from the starting point all the way to the finished product. We do pork tenderloin, we do roasted chickens, we do gourmet pizzas. We even do some things similar like grandma's meatloaf, but everything's made from scratch. We follow recipes, nothing comes out of a can. Our sauces are all made from scratch. When you walk into our dining facility here name is Cafe 114. It feels like a real cafe. You don't walk into it and it's the old type of tray line service here. Every single day the menu changes. So for example, one day you may have a carving station with a prime rib on it, and the next day on that carving station may be a baked potato bar, and the plate itself is a work of art. It's just not something that's piled on the plate and sent to the guest or sent to the patient. It's a work of art because, you know, you may not always come in here where you just on a clear liquid diet. You can actually have surgery where you can eat regular food. So we have to take those cases and we want them to feel like, you know what, this is unbelievable. This is not hospital food. We don't ever want to be stereotyped or categorized as hospital food. We are a cafe dining facility. You can get fresh grilled salmon, we have fresh tuna here, we have a fish of the week, we have grilled pork chops you can get, grilled chicken. Along with that, you can have that grilled, make your salad, give it to one of my grill cooks and we'll put it on the salad for you. It really starts with Chef Jason Douglas. This guy is absolutely amazing when it comes to food. He is truly an artist when it comes to the culinary aspect of it. He has an eye for making your food look so pretty and edible at the same time that you don't want to touch it because it looks so great. That's one element about dining service I don't have to worry about because I know when he's there, that the guests, our patients, are going to get the absolute best that he has to offer every single day. So what we try to do is we try to be innovative with our food, very cost effective, but most importantly, we want a great quality of food. I have this saying that if it's not done in the spirit of excellence, we won't serve it.
Did you know Forest Park Medical Centers utilize a paging system similar to those found in many restaurants today? The paging system notifies patients' family members as to their location and status while undergoing surgery at Forest Park. The system also allows the surgeon to contact the family members to update them on their loved one's surgery.
From staff to surgeons to technology and technique, Forest Park Medical Center is bringing you the very best here in your area. Now let's go on to our next doctor, plastic surgeon and reconstructive specialist, Dr. Ned Snyder.
I went in for a regular mammogram, just a yearly thing, and I had a DCIS in my right breast, diagnosed the day after Christmas. Some mutual friends said, oh, you know, we have a doctor who's, you know, supposed to be the best in his field. And I was like, yeah, you know, I'll just give him a call. And this gentleman, this Dr. Snyder, took so much time with me, spent the day after Christmas on the phone with me, walking me through all the different options and what my diagnosis really meant, and, you know, not to freak out, and this was really doable, and I felt so confident after I spoke to him. Dr. Snyder really won me over with the fact that he was so willing to give his personal family time to me when I was in a state of crisis. But I will say, when I started researching all the local doctors and, you know, really seeing what my options were, that's when I realized what a rock star Dr. Snyder is. You know, just from every angle, people praising him.
So Kate had breast cancer and elected to have bilateral mastectomies. She had reconstruction then with bilateral DIEP flaps, or DIEP flaps, which are flaps where we use tissue from your abdomen, skin and fat from the abdomen. We take a portion of the blood supply out of the muscle that sits below that skin and fat. We disconnect it from the abdomen and then reconnect those blood vessels in the chest. So we're making a breast out of what a breast is skin and fat, and it's 100% her own tissue.
What happens, it's actually pretty intense, and it's super science. It's a 17-hour surgery. The first surgery is done by your surgeon, not the plastic surgeon, so that would not be Dr. Snyder. And that's just the mastectomy, the removal of the breast. And then the second surgery, and the mastectomy is the 2-hour surgery. The rest of the 15 hours is him using my own fat tissue to reconstruct the breasts, reconstruct all the blood vessels. It's pretty intense stuff.
When we use your own tissue, it's something that's going to age with you like normal tissue, like normal breast, and won't require maintenance per se over the course of your lifetime. Once you're reconstructed, it's yours, and it's yours to keep.
It feels great to 4 or 5 months later say, I'm done. I feel great, I'm active, I'm back with my family. It's exactly where I want to be.
Thank you, everybody, for tuning in to this week's episode of the Best Docs Network featuring Forest Park Medical Center here in Austin, Texas. For more information on Forest Park Medical Center and their doctors, log on to our website, bestdocsnetwork.com, and click on that Forest Park Medical Center tab. We'd love to hear from you, so email us at info@bestdocsnetwork.com. So long, everybody, and we'll see you next week.